Hello and welcome to Aware and Care, your weekly prescription program with Dr. Ambika Nair. Thank you so much for your feedback and love for this 15 minutes capsule that we have brought into the new series. Over the time of last 1 year plus, we have brought many conditions, symptoms that Dr. Ambika Nair has been kind enough to share with us whether certain conditions are treatable, curable, manageable. And I think that's the only question most of us have. And keeping that in mind, we are bringing this capsule series for you. Let's welcome Dr. Nair to the show first. Namaskaram, Doctor.
Namaskaram, Madhavi. How are you?
I'm doing very good, Doctor. Thank you for all the inputs that you give during the show and otherwise too when we come to the clinic. Dr. Nair, we talk mostly about our appearances, and you have always insisted that the appearance and the way you look is always about how you're feeding the body and the mind, and that's Ayurveda. Today, we want to talk about a condition which is very chronic, very rampant, and many people in statistics and numbers across the globe, it's increasing. And today in America too, this number is at a staggering number. We're talking about chronic kidney disease. The kidney plays a very important role to filter out the waste. And the waste is not gone, the toxic is built up. And that's one of the things that you talk about mostly in the program. So today, please define to us what is chronic kidney disease. And we will go to the next question after that as to how it can be treated.
Actually, it is a renal failure. It is diseases with the, kidneys only, as he told. It can be chronic, it can be acute, actually. It's a very slow, progressive decline of the kidney function.
Mm-hmm.
It can be related with some other complications of other diseases, like a very chronic, any chronic diseases, like a hypertension, when we don't take care of that, like unmanaged diabetes.
Oh, okay.
And even, in certain thyroid cases, we have seen that in hypothyroid, it happens like that. And even chronic malaria.
So this is one condition which...
So you're saying that... Stop, slowly start working, actually. Then it will lead to, end stage of renal disease, actually.
So does it always happen that there is already an underlying health condition, or kidney disease can happen just out of the blue as an independent disease also?
See, it can be independent. If the in uric acid diathesis, we have seen in sleep apnea patients also, when you see their blood work, you can see their creatinine level is on the higher side. They have like a snoring, so much of snoring. Not all the snoring people, should not be get upset, because it all depends upon the patients, how they are suffering. And their urination also, smell will be there. Sometimes, like a frothy type, you can see cases, as you asked, without, it can be like acute also, any injury to the kidney also. If your lifestyle, you were not sleeping for a long time, like overdoing the work, overtaxing, so much of stress, eating like a virutahar. So this all can lead to that also.
So Dr. Nair, do we always have symptoms for kidney disease, or there are sometimes that asymptomatic, slowly the body is unfunctioning, and suddenly you come to a condition where you realize that, oh, the kidneys are completely damaged. So how does that happen? Are symptoms always the sign, or you should just get a regular checkup?
No. Regular checkup is a must, actually, because nowadays everybody goes every 6 months, even yearly checkup also. But some days, you feel that very fatigue will be there, breathlessness. So these are one of the, your hemoglobin may drop down very fast, frothy urine, smell from your urine. Some days the smell from your body, odor will be there, actually. Okay, very dry mouth, little symptoms like this.
And what about pain?
Pain is not a must. That some days, the joint pain will be there, mobility will be a little bit disrupted with that. Normally, it is seen in diabetes patients, hypertension, obstructed urine flow. See, you cannot pass it. So many patients comes and tells, the flow is, a very thin flow. It takes so much of time to, if it is male, we see that whether it is with the, their other issues.
That is. So there is also this fear that when you say CKD, chronic kidney disease, that the it is very fatal. I mean, if it's not treated, it is fatal. It's like most conditions. So how treatable is this condition? That is the first question. I think most of the time people text us.
It can be, it can be treatable, but, we have to find out what is the real cause, whether it is with the polycystic kidney disease, whether any nephritis, glomerulonephritis, okay, any other toxin in the body, whether, some children, they are born with such diseases.
Oh, they do? Okay.
Yeah, congenital, like there will be obstruction in the ureter or kidney malformation. Whether any lupus was there for the patient, like any other medications what they are using without any prescription for a long time, any like illegal substances like heroin or anything, cocaine and all, take it, then malaria or yellow fever, all those things, replay way hard, like it has to be ruled out.
So
that is more important, actually. Yeah.
We're talking about chronic kidney disease and symptomatic or asymptomatic, both conditions definitely, doctor, just like Dr. Nair just mentioned. There's always an ideal condition where, these things can be treated when you're capturing it at an early stage. And also if you chronically get yourself tested or your physical wellness is done on an annual basis. So Dr. Nair, when we talk about CKD, the first fear which comes to us as we're talking, our mind definitely goes towards, kidney transplant or dialysis and all that. But those are later stages. It can be curbed at an early stage.
Madhavi, actually, like we can see some people will come and tell, my cognitive power, I cannot remember the things now. Understand? Loss of appetite also, little nauseated feeling, vomiting. Some people vomit a lot, actually. Sleep, they cannot sleep in time, they are awake, swelling of the feet. These all are observations what we have to do it, actually. Some people will tell, like my whole body itches, doctor. That is another thing. Shortness of breath, I already told you. If the fluid build up in the lungs, and you can see, when you examine, you can see the pitting edema. Okay. And the face also like, like a moon face. They are like a waxy. They look like a wax.
Oh, okay.
Typical cases.
It's bloating and
yeah, and like itching will be very, twitching of the muscles will be there. Sometimes cramps, they cannot lie down, very restless legs.
So that I'm sure most of the viewers must be. Yeah, and that's exactly, friends, this program Aware and Care is to just bring some awareness, and with age, with time, certain functions of the body are deteriorating with wear and tear. And Dr. Nair also mentioned that some people may be born with this condition. So in both cases, getting hold of the condition first and then the treatment processes just also happen. I've also heard of cases where people were born with one kidney. I personally know a couple of friends who were born with one kidney. So in that case, your health of your kidney matters a lot and how well you take care of it. So Dr. Nair, when you talk about CKD and Ayurveda, how does this parallelly? What kind of treatment procedures, or how hectic is this treatment when it comes to Ayurvedic perspective?
Actually, like depending upon the case, if the creatinine level is like 12, 14 and all, we don't advise, because some people are very reluctant in going for the dialysis also. So we get a lot of cases like that. So they come to us, we see their results and all. We do the panchakarma.
Okay.
Even I have a handful of cases even now. They are doing amazingly. They have improved.
This is so nice to hear.
Yeah. Panchakarma, according to the condition, whether, the skin issues means then we will be giving them takradhara, even shirodhara, so that, like pitta vada, it will be related. You understand? So restless, and they are so fearful. They think that is the end of life. Then, we take them into confidence after the, Nadi Pariksha, talk to them nicely. Their hemoglobin, there are very good, herbal medications also available. So these all, we give them under their diet, everything, they are doing very well, actually. Yeah.
Friends, don't you love it when Dr. Nair says, they're doing fine and they're doing very well? Because that's all we want to hear. Yes, we have had situations where the body has gone through certain conditions, but the kidney disease, chronic kidney disease, and the health of the kidneys is very important because the toxics from the body needs to get out. Otherwise, other secondary factors do come in. Dr. Nair, there's always this myth that if you drink lots of water, your kidney will always be very nice. Can you give us a little more information about what this actually means?
No, that is flushing of the kidney, like people, like you see, especially when you're working, sitting and working, you're a little lazy also, you're too busy also to go and collect some water. So I always advise everybody, keep at least, buy a big bottle, keep water over there and, keep on drinking it because nobody can drink for you. You have to take care of that. And even I have seen some patients, they come with some toxins from some jewelry what they were wearing.
Oh.
So, because their creatine was on the higher side, it affected the kidney. So, so she, because it was an acute case, so she has to be given one, dialysis for that. Okay, so afterwards she came to me because it was very emergency at that time because she was on a vacation or something like that. Okay, so some lead or something like that. So maybe some jewelries, that we have to be very careful also what we wear.
Yeah. And my next question was just about that because when you said jewelry, I was thinking about lead poisoning because that's also one condition where the toxins in the body was increasing. So it's also the work environment where you are, where there's not proper air circulation, paint factories and other factors where, you inhale a lot of fumes and that could also lead to a lot of toxic inhalation. So Dr. Nair, chronic kidney disease, does it also lead to sepsis or that is completely different?
That is completely different actually because the system failure comes over here actually. So the shortness of breath means it affects the heart and all system will get affected actually. Okay. And you can see their tongue also, when we see itself, we know that what is their condition. Hemoglobin, because there are so many, even diet and, first of all, they will be mentally so much tired that so many people will tell, oh, we are doing the dialysis weekly, thrice, 4 times. Will you be able to, help me? We help them. Very nicely, we help them. So provided friends, they are also willing to accept it.
Accept it, yes. So friends, we were talking about being at a capsule program. I know everybody is very anxious to know about are there any home remedies that we can do or how to take care of the kidneys right from the home before it can get damaged. But before that, I want to ask one more question to Dr. Nair, that is this condition hereditary or it passes on through, skips a generation and comes in out of just the body?
Hereditary, it can be hereditary also, but if you take care what you eat. See, what if the digestion is good, whatever you eat and if it assimilates, and absorbs, then there is no issue.
Right.
Then that sometimes, you get like a pain on your left toe, you have a lot of pain. That is all uric acid only. If the uric acid, if not taken care, means it will lead to kidney diseases.
Okay.
Yeah. So many people will come like this, like gout. That's what I'm talking about, gout.
Right. Yeah. So now let's come to the very important aspect of the program where we want to give information to our viewers about certain foods that help to avoid this condition or reduce this discomforts that come with kidney disease. What kind of foods
high protein should be avoided actually.
Okay.
That's why we always tell, meat and all should be avoided. You should eat only more vegetables. Ginger water is very good. Triphala you can take every day at night so that you don't get a constipation. We have to check the potassium level. Okay, so it should not go very high.
But Dr. Nair, I know there's a little conflict point here, and you would say that it depends case to case. When you mentioned that you have to avoid high protein food, but there is this fad right now that, have more protein, build muscles, people are going to gyms.
If the kidney is good, they can eat whatever they like.
Okay, there you go, friends.
Yeah, because actually, because I get a lot of, I take only protein shake. You take any shake if it is working on you. But if you experience, skin itching, breathlessness, fatigue, swelling, then you have to really go for your blood work or you see your primary doctor or, so that you need a help.
Okay. So that was as simple as that, friends, that yes, you can take proteins, but depends on your health condition. For that, an annual checkup, a physical checkup is very important, because there are situations and cases where Dr. Nair is treating where they're asymptomatic and just out of the blue, they get a blood report and the numbers are really alarming. So that is one very important precaution advice that we give you here on Aware and Care, aware of all the other conditions and facilities that are available in your neighborhood, whether it's Ayurveda form of healing or information like programs like this. Dr. Nair, any kind of other things that you want to suggest to our viewers? When you said toxic, what kind of other toxins are you talking about to flush the body? Are there any rituals that people can follow on a monthly basis or weekly basis to keep their system clean?
It should be daily basis. Clearing the kidney is daily basis, actually. Like you boil, like ginger water and gokshura is very good, that is very nice.
Mm-hmm.
You should pee properly. And you should examine your urine, whether it is frothy or anything, any smell is coming, all those things. Check your nail and check your blood also, whether your calcium level is okay. So these are all things, like hemoglobin and all. We can make out, such people when we see it, sir. Yeah, they are very fragile also.
So friends, today's episode of chronic kidney disease, we just wanted to get it out to you that through Ayurveda, this condition is definitely manageable, treatable. And for other aspects of it, what stage of your kidney disease you are working on or you need treatment for, you need to visit the doctor, get a consultation and talk more. And keeping the COVID protocols in mind, keep your vaccinations and masks handy, and so that, when you meet the doctor, you know that you are directly accessing her. Otherwise, they also provide you online consultation. Any final words that you want to share with the viewers, Dr. Nair?
See, especially diabetic cases, I have seen that.
Mm-hmm.
If you don't take care of the diabetes, definitely it will harm you. And don't overeat.
Maintain your
eating
weight.
Sweets, because you see, some people will go because of the festivals and all, I forgot myself and I was eating. So it all, like you have to be aware, like our program, Aware and Care. If you care yourself, then you have to be aware what your body is. Then only, like what you should eat, what you should not eat. You should always come to an Ayurvedic doctor or any Ayurvedic practitioner and see what your body type, what diet suits you, whichever way you can take care of, so that you don't need so many doctors.
True.
Even the Ayurvedic doctor, I'm telling.
Okay.
So you're your own doctor,
Yeah. That's a very important point Dr. Nair just mentioned, and we've spoken about this in many times in the episodes, that sometimes you have a craving for a particular food. You feel that you love this food, but it would also be a deficiency that is creating this desire in you. So get yourself checked up, get your understanding as to what your body type is and what kind of foods suit your body the most. Am I right, Dr. Nair?
Absolutely.
Okay. Thank you so much for today's episode on chronic kidney disease. And just like this, we'll bring you many more episodes, short capsules for you to understand what is a condition and what are the symptoms and how Ayurveda can help you from the comfort of your home to get treated and feel well. Please like, share, and subscribe to the episodes and share it with your friends so that any condition out there, especially in these hard times, do not hesitate to reach out to a doctor. Thank you, Dr. Nair.
Thank you so much. Thank you.